Thank you so much for joining us for this first call. Do we want to go around and do introductions really quick? Courtney and Betsy, do you know each other?
This is Courtney. I do not know Betsy.
Okay. Do you want to introduce yourself, Courtney?
Sure. My name is Courtney Cryer. I'm the director of the Family Center at Montrose Memorial Hospital.
And Betsy? We are not able to hear you. You might be double muted. Betsy, are you able to chat in your information? Oh, well, she's working on that. As a reminder, I'm Valerie Garrison. I'm the Director of Initiatives and Engagement with CPC-QC. I do the direct engagement with hospitals for our quality improvement initiatives. And Betsy chatted in that she is the labor and delivery and NICU manager from Lutheran Medical Center. Thank you, Betsy. Sorry about the technical issues. Callie, do you want to introduce yourself?
Sure. Good morning, everybody. I'm Callie Valdez, and I'm the coordinator for CPC-QC.
Okay. So as I mentioned in our emails, we wanted to start this quarterly webinar series as a way to better support our quality improvement hospitals. So the idea of this series is to get hospitals together who are working on the same initiative quarterly to really have presentations by each of our teams. So perhaps somebody has some great success that they would love to talk about and share to spread best practices, or maybe teams are experiencing certain challenges and we can either have somebody present on a challenge that they're having, or if there's a common thing that comes up throughout the course of implementing our initiatives, we could bring in clinical speakers or others who can help really address those challenges. So the idea is that in general, this webinar series will be for your whole quality improvement team. So anybody who's working on the SOAR project, your docs, your nurses, your data entry folks, anybody who's involved is welcome on these calls. And I think the more people we have, the better conversations will come out of it. The exception being, this is our first call, and we invited only the team leads and data entry folks because we're really going to focus on, it became clear to me that data entry in the AIM data center was causing a lot of confusion across sites. So we're going to cover that today. We're actually going to have a fairly short call. So full disclosure, I accidentally double booked myself today. So we are going to end this meeting at 10 o'clock. So happy Thursday, you get 15 minutes back. But trying to advance my slides, there we go. So today I really want to just do a brief overview of the measures that are reported in the data center, and include in that a very brief bundle overview and talk about how the AIM bundle fits within the SOAR project. Then I will go into the AIM data center and show you where to enter your data and how. And then we'll kind of go through and start exploring the reports so you can see how the Colorado cohort compares to other programs across the country. And then if we have time, I'll do a quick REDCap check-in, and we can discuss ideas for topics for the next call. Before I jump into the AIM bundle overview, I know different partners have kind of a different level of familiarity with the bundles. And I wonder if both of you, how familiar you are with those AIM bundles. You can either chat that in or just go on speaker.
Val, I guess I'm trying to understand what you're saying. Familiar with the bundles, meaning the bundles we implemented with this?
Yeah, so both the AIM bundles overall, and specifically the cesarean reduction bundle.
We are pretty familiar with it and utilize it.
Okay. Okay, so you're both pretty comfortable with the bundles. So as you know then, we integrated this bundle into the SOAR initiative. And as part of being an AIM state, we are, and if you wish to, here's a link to the full bundle if you want to review it. And I'll send these slides out with all of the links. But as part of implementing the bundle as an AIM state, we're required to enter our data into the AIM data center. There are 3 types of measures that we're entering into the data center. Those are structure, process, and outcomes measures. So you can think of the structure measures as like, here are the systems and the resources and the policies and protocols that we have in place to implement these best practices and standardize them across our whole unit. The process measures really look at what are the activities that we're taking to support our staff, how well are we following protocols, those kinds of measures. So use of the labor dystocia checklist would be an example of a process measure. And then there's the outcome measures, those immediate outcomes, so the NTSV cesarean rate, but also those balancing measures that we look at to track overall population outcomes. So the outcome measures, you all do not have to worry about. Those are being pulled and reported by Colorado Hospital Association, and CDPHE is sharing data with us to upload as well. So we have those outcome measures already in the database, and you don't need to worry about entering those for your site. So the things that we will be asking you to enter into the AIM data center are those structure and process measures. And the idea is, first of all, asking sites to enter their own data into the system is partially a way to give you access to being able to go in and view your data and view the dashboards that let you look at your data compared to the rest of the AIM cohort, not just Colorado, but across the country. And I'll show you that in a moment. So the structure measures that we're asking you to report on really relate to the protocols that you have in place for engaging with families around providing support in the event of an unexpected cesarean, and also making that decision for moving forward with a cesarean versus vaginal birth, etc. And then also, what are the guidelines and procedures that are in place? And do you have those integrated into your electronic medical records? So for example, is the labor dystocia checklist built into your EMR system? Are there flags that pop up with, oh, I see your cesarean indication was failed induction. Did you try these steps, for example? And then is your team doing a multidisciplinary review of a random sample of your NTSV cesareans and ensuring that those are conforming to the best practice guidelines? And I know many of you are doing those reviews. So those are the structure measures. It looks like a lot. It's really only just 5 quick questions, and I'll go over that in the system. The process measures, there are just 4 questions that relate to what proportion of individuals on your unit have had continuing education in the past 2 years that relate and specifically addresses elements of the bundle. And then for that case review element, how many cases did your team review in the past quarter, and how many of those met the bundle criteria? So that's just a simple numerical. Any questions before I move into the data center?
No questions on my end.
Thank you. All right, so when I send this out, this is how you will access the AIM data center. Everybody who is doing data entry for SOAR has access to this, this portal site. If you forgot your password, you can go through and use the password reset, but please do feel free to reach out to me if you have trouble accessing. I am an admin for our site, and I can go in and manage hospital users, so I can help you get connected. So you can click on this image or the link, and it'll take you right to that login page. So I'm already signed in, so we're not going to worry about it. Okay, so when you sign in, you're going to go to your hospital dashboard, and you will see a data entry table with tabs for the different data types. So you'll see here that for the hospital measures, there's just the 2 tabs for the process measures and the structure measures. So again, you do not need to worry about those outcome measures. If you have any questions about your outcome measures or where they come from, I am more than happy to share those. And as you can see, so we're on the structure measures data entry page, and it's really simple. So there's your 5 questions of, do you have these protocols or guidelines in place? So for the AIM data center, we do quarterly data entry. So if you have this guideline in place, you would just put in the date that it was implemented and save it. Once you put that date in, it will carry over from quarter to quarter, and you won't have to do that particular one anymore. If you do not have the guideline in place, you would click not in place, save it, and then in the next quarter, you would either need to put that date in if you implemented it during that following quarter, or once again, click not in place. Just to repeat that, this is quarterly data entry, and you only have to continue every quarter until you enter a date for all of your guidelines, and then you don't have to worry about that anymore. Any questions about that? Okay. And then you also will go to your process measures tab, and you'll click on the relevant quarter. So notice that this says it's editable on 7/1/2020. So in our quarter 1 2020, you'll go in and you'll see those 4 process measure questions. So for the proportion of physicians who have completed an education program, it's really a range, it's approximate, and it's of your whole unit who in the past 2 years has done something related to the unit standard protocol. And so, you know, maybe it's 100, maybe it's 75, you would just select the range. And then the same for, the education around reduction of, safe reduction of primary cesarean. And then you just put in the number of cases reviewed, and of those, how many met the bundle criteria. So that's really simple for your data entry. I do acknowledge that we have not had conversations about P1 and P2. And so one thing that I'm unfamiliar with is whether your units have a process in place for knowing what the continuing education has been for providers and for tracking that education. And I would say that, you know, anything that CPCQC does in the context of SOAR, so the labor support workshop that we're working on rescheduling for the fall, any other educational sessions would really fall into this. So any of your providers who participate in those would count toward this total. Any thoughts on that before I move on? Okay. It's all pretty straightforward. I think just acknowledging that I know there are a lot of different data sources and timelines and things like that. So they can all kind of get jumbled together and be a little confusing. So one thing you will also see when you log into the AIM portal is you have the ability to compare to other hospitals and to view your own dashboard. And so I just wanted to show you the compare feature and how it works. I was under the impression that you were able to compare your hospital to other hospitals of similar type. So for example, if you have less than 500 births a year, you can compare to other hospitals that have less than 500 births a year. I'm unable to see those specific comparisons in my dashboard, but I believe that's because I only see our cohort total. I'm not able to break it down by hospital. So you'll see when you go to the comparison, you can see there's a comparison section for each of the bundles. So you can just scroll down to the safe reduction, and then you can compare the measure that you are interested in. So I won't look at the process or structure measures because we don't have a lot of data in there for Colorado right now. But let's look at, so our NTSV delivery rate after labor induction. So you can see this lets you see, compared to other states who are entering this data, how we stack up. And so actually Colorado does a really great job. We tend to have a lower cesarean rate overall, and you all have done a fantastic job of lowering your rates. And you can change it by the time scale, so you can just look over time for all of the data you have. You can do quarterly or annually, and then you can change. So if we look at severe maternal morbidity excluding transfusion, it'll just take a moment to load. You can see there's much more data for many more states. And actually this is something where Colorado kind of saw a jump. It's actually probably not a jump. I'm guessing our rate was already higher. But you can see our rate is much higher compared to the other states that are participating in this initiative. And we went down a little bit after implementing SOAR, but we're kind of sustaining up in that over 2% range. So this is a good way to kind of look and see and compare across the country. And it's also a way to see, like, wow, okay, so what is Maryland doing where they've dropped their rate down this far? Is it just that they're not reporting, or have they had some great successes in the last few quarters? And, you know, it looks like Utah is doing a fantastic job of maintaining their rate very low. So maybe they're a group that we would want to reach out to, for example. So that is the AIM Data Center. I want to give you an opportunity to kind of pause, ask questions. And I also fully acknowledge it's possible that my view is different from yours. So if at any point you log into the AIM data center and you're like, wait, where am I supposed to go? What am I supposed to do? We can set up a Zoom call and do a screen share and look at what you're seeing. And I'm more than happy to help you try to navigate that. Okay. So I'd like to move along from the AIM data center information to the REDCap data submission check-in. So I sent out our monthly control chart data last week, or earlier this week. You should have received an email from Sendinc at some point sharing your monthly control chart data. And I included in that message checking in to see, it recently came to my attention that we are able to do a file data upload into the REDCap service. So instead of going in and doing the manual entry for every NTSV cesarean that your team had in the past quarter, it is possible, if you have an EMR that allows you to do this, to work with your EMR team to develop a report export that you can then just share with me and I upload directly to REDCap. So there's still a little bit of a manual component to that, but it would be much faster and more efficient for your teams to go ahead and do that. And so I just wanted to check in if you all had seen that message, if you had thought about that possibility, and what your thoughts on that are.
I have not seen it.
Okay. Does that sound like something that might be possible for your site? And I guess a different way of asking this is, you know, I also acknowledge that the data entry into REDCap is time consuming. So I would love to hear if you've been experiencing challenges with being able to enter your team's data, or if you have other anything you want to say about REDCap data entry.
So, I mean, you've seen my stuff. I'm not sure how I'm comparing to the other hospitals, but I do struggle to find the time to get everything entered. It's not hard to do. It's just finding the time to do it. And so it's funny. I'm actually sitting here, got it pulled out so that as soon as this meeting's over, I'll try to enter in the last month or two that I'm missing. But just hard to find time to enter the data.
Yeah, absolutely. So, and it looks like Betsy might be chatting in. Betsy chatted in. It has been better since we limited to only cesarean deliveries. And they have some new nurses who can help enter, so that is helpful for the site. But again, yeah, you know, recognizing this is not a key part of your job, finding time in any day, even if it's just once a quarter, to go through and enter that data. So anything, you know, we are happy to explore. If you have a medical record team that can program reports for you, we can explore doing that to see if we can shorten the data entry time for that. Related to that, we also recognize, so there's the value of having that data feedback. And we also recognize that all of our sites have been doing this project for over a year and up to 2 years. And so, thank you, Betsy. So Betsy just asked, do we know how long we will be entering data? And that's a great question. So that's a perfect transition into what I wanted to say next. So we've been having conversations at CPCQC about, you know, how long do we want this program to go on for, and for how long is it helpful for sites to be entering this data into REDCap. And one of the things we're considering and we're reviewing with the steering committee, and please share your feedback as well, we're looking at what is our timeline? So we know that when we first implement a quality improvement initiative, we really want to have that monthly rapid data feedback for 6 months to a year so that we can implement new changes and adjust as needed. And then after that first year, we transitioned to entering data into REDCap quarterly. And so we have but you're still entering all cesarean births. And what we're thinking about is we would like to work with our teams to determine an approximate timeline that can, of course, be adjusted based on the needs of each site. But really figuring out, okay, when do we start tapering off the data collection and how do we do that? Do we first start with, our whole cohort births quarterly entry, and then maybe reduce that down to a random sample of the births, and then reduce that down and eventually phase out that quarterly reporting? So maybe in the second year of implementation, we say, okay, the first quarter is all of your births, the second quarter is a random sample, the third quarter is a random sample, and then we don't report it in the fourth quarter. We can have that conversation one-on-one with your sites. I would love to hear your feedback. The main thing with that REDCap data entry is it is designed to help your team understand your data. So if at any point it just feels like a chore and your team is unable and it's not providing value for your team, we can have that conversation about phasing out the data entry. So if you're seeing, if you've reached a critical point where that report is no longer informing your process, that to me sounds like a good time to start phasing it out. And we can absolutely continue to provide the monthly and we can move it to quarterly, the control chart data, so that your team is able to keep an eye on just the overall NTSV cesarean rate. So once you've kind of reached you've implemented, you've shown some sustainability, you've really fine-tuned your process, and you're finding that when you look at your data, you're seeing like, yes, okay, we agree with this, we're good with this, we feel confident that we can continue forward, then you can use that monthly or quarterly control chart data to say, okay, yep, we're sustaining our change, we're not seeing the numbers creep back up, things like that. So that is a conversation I would love to have with your sites. I do recognize that considering it is time consuming, we want to make sure that that data has value for you. We have no interest in making you collect data for the sake of collecting data. And to that point, you'll see I have a note here about the reporting format. I believe I've checked in with all of you regarding the reports, but I am always open to people coming back and saying, wow, this report is great, it's really helpful, or, it's super long, there's a lot of great information, but what would really help me is X. And I can work on editing those reports to tailor and fit to the needs of your team.
So Valerie, I think for Montrose, we actually, it's almost like we double document or double report. We have our own internal process that we're doing all chart audits on our patients, and we report this at OB committee as well. So I do kind of feel like really I'm putting this information in for you guys. What
okay.
I do like, or what we all like, is being able to look at the other hospitals and seeing where they're at, and if they're having spikes at certain times and coming back down, or kind of mirroring what we're seeing within our own selves, or if we are outside of the box and we need to take a look at what we're doing. So comparing control charts, that is the one benefit I feel like to doing it. Otherwise, we're at a point, like you said, we're sustaining what we're doing and we don't really need it.
Yeah,
So
I
I'm
think
not sure
that's a
way
great,
around that.
that's a great point. Yeah, so it sounds like your site is just ready to kind of move on and really double down in the sustainability aspect. So we can, what we could do is with your particular site, maybe you and I can have a one-on-one call regarding how to move forward with data entry, because we can still provide that control chart data since that data comes from CDPHE. We can still provide that without you going in and entering your data into REDCap. So yeah, let's work on moving forward with that.
That'd be great. I mean, even just getting you the numbers and not necessarily having to go through all the questions because we're doing that on our end, but getting you the numbers and maybe the bottom line as to why we ended up going, 2 or 3 questions, that'll still get you your control chart and help us. I also want to say that, the doctors checking in once a quarter with the MFMs over there, that is something I want to keep going if at all possible, because that's a huge benefit to them.
Absolutely. And so we can certainly still continue doing that. And my hope would be that for these quarterly calls, that we will get the MFMs and other OB clinicians on those calls as well. So that's kind of we're kind of designing that as similar to the conversation that we had last month, but also really opening it up to the whole cohort. So partners who are implementing SOAR can support each other as well as learn from our steering champions who have been doing this work for a long time. So my hope with these calls is to kind of create an extra layer of that communication support.
Perfect. Thank you.
Okay, so I'm gonna move on. So our next webinar call is gonna be July 23rd. We're gonna stick with this 9:15 to 10:15 time frame. As I mentioned, the calls moving forward, we would love for it to be your whole team or whoever is available to come. We are recording these calls and we'll send out the slides after the fact. For those who are unable to make it, they can watch on their own time. But I'm wondering if anybody has specific topics they can think about that they would like to cover in a future call.
I would be curious what other hospitals are seeing. It goes back to the meeting that you were on with my OB docs when we did with the MFMs. But I think our concern has shifted to, now that we're sustaining this, we are starting to see some more difficult C-section deliveries with the babies that are engaged way down in the pelvis. So I would be curious what other hospitals are seeing and what they're doing.
Okay, great. I'm just going to give a moment in case Betsy is trying to type something in. And I also appreciate both of you joining us for this call, and I want to double check that you're comfortable with us sharing the recording of this particular call so that other sites can go through that overview of data entry.
Sure.
Okay. And Betsy chatted in that she would be interested in associating EMR and labor dystocia. So are you referring to integrating the labor dystocia checklist into your electronic medical record? Okay, yes. All right, yes, we can have some conversations about those topics in the future. So we are coming right up on the hour. I don't have anything else for either of you. So I hope you have a beautiful day. Please feel free to reach out if anything else pops into your mind. And thank you for joining us.
Thank you. Have a good day.
Thank you. Have a good day.